Also, and from our records we note that she don't have a history of peptic ulcer disease. And further discussion with the patient, she revealed that she is purchasing the ranitidine from so long, and because she was getting less effect with that dose of ranitidine, now she came to purchase the high dose of the ranitidine. And when we asked her about the symptom, she revealed that she is experiencing the symptoms like nausea, occasional vomiting, and abdominal discomfort, and also she have a complaints of recent weight loss. Her only medical condition or past medical history she have is pernicious anemia, and for that pernicious anemia she is taking the hydroxymethylcobalamin. Okay. So we know that when the patient hospitalized, clinical pharmacist will give the pharmaceutical care, or he will take care of the patient, what medication he is taking and whatever the symptoms the patient experiences. But when a patient comes for a community pharmacy to purchase a OTC drug, as a community pharmacist, it is his responsibility to look into the patient condition and also to look into the whatever medication the patient is taking. Here, this is the case. Here we have an actual problem. That is, patient is she is experiencing the nausea, vomiting, and abdominal discomfort. From 2 years, she is taking low dose of ranitidine. But since her symptoms was not relieving with the low dose of ranitidine, now she came by asking the high strength of ranitidine. And now here the community pharmacist suspect that the reason for this pernicious anemia may be the long-term use of the ranitidine. Why? Because when we take the ranitidine, it will decreases the level of the parietal cells and it will decreases the capability of the parietal cells to produce the acid. And as we all know, for the absorption of the vitamin B12, we need the gastric intrinsic factors which will act as a transporter. So once vitamin B12, when we take through a diet, it will bind to the intrinsic factors and it will enter the systemic circulation. Then only it can be transported to the other body parts. Since here the patient is on the ranitidine, it is suppressing the activity of the parietal cell, and meanwhile it is suppressing the activity of the intrinsic factor. Because of that, patient is taking the hydroxycobalamin because of the pernicious anemia. But this condition is not known by the doctor whom she was consulting before. Why? Because she didn't reveal that she is on a ranitidine from so long. Okay. Now the community pharmacist has identified this condition, and through the skit we are going to show how the community pharmacist is going to tell these things to the doctor.
Hello, good afternoon. I am Shamli, your pharmacist. How can I assist you today?
Hello, I need to purchase some high-strength ranitidine.
What symptoms you have? Why you need ranitidine?
I have symptoms of heartburn, abdominal pain and vomiting. So I need to buy high strength because low strength is not working.
According to our records, you don't have peptic ulcer disease. Can you please tell me more about your disease condition?
I have pernicious anemia, so that I am taking treatment.
Okay, come to our counseling area. We can discuss about this. Can you please brief your medical history?
As I already said, I have heartburn, lower abdominal pain, so I need ranitidine, and I am suffering from pernicious anemia, so I am taking hydroxycobalamin 3 months once.
From how long you are taking ranitidine?
I think I am taking from last 2 years, but it is not relieving my symptoms.
According to the details you have given, I suspect you might have peptic ulcer disease or other gastric disease. And maybe your ranitidine might cause pernicious anemia.
Oh, is it? What can I do now?
It's better to consult a doctor for further diagnosis.
Whom to consult, ma'am?
I know a doctor. I will inform your condition and you can consult her.
Thank you, ma'am. Thank you for the help and thank you for the referral.
patient.
Excuse me, ma'am.
Please give me. How may I help you?
Pharmacist Shamini has sent me to consult you.
She explained your case. Let's discuss in detail. What symptoms you are currently having?
I am suffering from lower abdominal pain, heartburn, and vomiting.
It looks like you are having peptic ulcer disease. I have to do some tests to confirm whether you are having peptic ulcer or not. Better to do these tests. Till that you can continue on low dose ranitidine. After that, after we will get the results, we will discuss that what treatment you have to take further.
That's all? Only ranitidine?
Better you should modify your lifestyle and diet changes like you should avoid carbonated juices, coffee, and spicy things. Then next treatment we'll discuss once the reports will come.